So Melbye, pleasure to meet you. Thank you for joining me today.
Thank you.
You wear so many hats. So I wanted to ask you a little bit about one of the projects you're working on here at Stanford. Can you talk a little bit about the research that you're collaborating on here?
Sure. We have a very exciting project on pregnancy. Pregnancy is understudied, and for many years we have had a very large cohort in Denmark of 100,000 pregnant women that we have interviewed and drawn blood from and really tried to understand pregnancy in greater detail. But from that study we now understand that we need much more detailed information on the individual pregnant woman. So we have started a new project where we actually bleed every pregnant woman before she becomes pregnant, every week during pregnancy.
You do what to every week?
We draw blood.
Oh, you draw blood from every week, blood samples.
So from before she becomes pregnant, every week during pregnancy, and then if she actually goes all the way to week 39 of pregnancy, we ask whether she will deliver a blood specimen every day up till she delivers. And then also we get blood specimens after her delivery. And with all that blood, we actually apply new technology that they are really experts in here at Stanford. So we do what we call untargeted metabolomics. So we measure tens of thousands of metabolites, analytes in the blood, proteomic structures, cytokines, and try to really map out week by week how a pregnancy is different. At the same time, we, in collaboration with people here at Stanford, try to also understand the fetal development, the unborn child, because you can actually draw out of the maternal blood information from the fetal development. Free RNA, a technology developed by Steve Quake here at Stanford. So we combine all that information.
So at Stanford, they're more focusing on the fetus, and then back in Denmark, you're doing most of the research with the pregnant women?
We do it in combination. Okay. And one idea here is to really understand the normal pregnancy in great detail, but then to apply that also in combination with abnormal pregnancies. Because we have blood from these 100,000 pregnancies in Denmark, and some of these pregnancies turn out to be not normal. So you can use that information with the new data that we gain to really understand whether we can predict abnormal pregnancies very early on.
So we might be able to help women
exactly that way
predict if they're going to have an adverse outcome with the fetus.
Yeah, exactly. So gestational diabetes, preeclampsia, preterm deliveries are targets of us that we look at. So those are some of the aspects of the studies that we are doing.
And heretofore, pregnancy, as you said, had been relatively understudied. Why do you think that is?
I think some of the issues relate to that we haven't had the tools to do it in great detail, the tools that we now apply. There have been many studies of pregnancy, but it has been difficult to really get the deep understanding of the developing pregnancy as we can do now with these tools. So pregnancy is probably one of the most changing biological phenomena in human life.
Absolutely.
So it's very important to really have much more data on that.
What do you think some of the next steps are? You mentioned that you're looking in the blood at things like metabolites or cytokines, which for people who don't know are kind of markers of inflammation made by your immune system. What other things would you like to study in the future?
Well, we have another project that we have started. You may know that if you give birth to a child, you have a 9% reduction in breast cancer risk for the rest of your life. So just because you're pregnant 9 months gives you this reduction in breast cancer risk. If you have 2 kids, you have a 9% further reduction of risk. So I usually say you can determine your own breast cancer risk by the number of kids that you have. Now, what is it that a pregnancy does that make you have a reduced risk of breast cancer for the rest of your life? No one knows. To start, really understanding this, we have in Denmark and the Scandinavian countries registry systems that are unique. So what we have done is to really study the length of pregnancy and how long into pregnancy you have to go before you get this reduction of risk.
So potentially we could eventually harness this for women who are not pregnant at the time.
Well, that's what we're going to understand. So we now know that this protection takes place from a particular week to the next.
Oh, you've already figured that?
We have figured that out
right now?
What week
is it?
It's later in pregnancy, I can say. And so knowing that we now apply the same technology of omics analysis, where we study these tens of thousands of analytes and proteomics, to really understand what makes the difference between the week that you don't get the protection to the next where you have it.
Right, so in other words, it's more of a switch than it is a gradual build-up of protective factors?
It's a very distinct switch from one week to the next. And by hopefully understanding what happens between those 2 weeks, we may actually get closer to an understanding of what makes you protected against breast cancer. And if we can actually take that knowledge and transfer it into treatment, that would be marvelous one day. But it's really a long shot. But that's my next project.
Well, it seems like a perfect collaboration because, as you said, Denmark has a rich kind of mine of data in these registries that we really don't have in the United States.
Yes.
What do you think ultimately you can be able to do with this? Do you think it's something you could hope to translate to women who are never going to be pregnant, or are we at this point we're just figuring out what's happening?
Well, I certainly hope. The whole goal is to actually put this into clinical practice, and for the pregnancy studies that we do here at Stanford to really develop tools to early, detect those that are at high risk, the high risk pregnancies. But also with respect to, say, the study on preterm delivery, it would be wonderful if we could put that into a tool that could be applied to the developing countries to really also lower the incidence of preterm deliveries, which really cause a lot of morbidity and suffering.
Right. And preterm deliveries are premature babies.
That's premature babies. So we really need tools to really predict those at-risk pregnancies to make sure that they actually go to term to really reduce the morbidity in the child.
This is so interesting. Thank you so much for speaking with me today.
It was a pleasure
to meet you.
And pleasure from my side. Thank you.